welcome to Hashimoto's Unfiltered, real talk, real solutions. The podcast where we cut through the noise and get straight to the heart of living with Hashimoto's. My name is Dr. Ray Benedetto, your host, and I'm here to share my expertise, personal insights, and from time to time, conversations with incredible guests to help you take control of your health. Together, we'll explore actionable items, debunk myths, and navigate the complexities of your thyroid health. So whether you're newly diagnosed or a seasoned warrior, this is your space for unfiltered truth and real hope. Let's dive in. So you can see the topic of today's conversation, one that I've kind of touched on numerous times in varying forms over the years, but still something that I get all the time. So I think it's worth kind of revisiting, if that makes sense. And here's how the story plays out, right? So the story plays out. I have a chat with somebody, I have a consult with them, or they're messaging me, or they're emailing me, or whatever. And however they're getting in touch with me, or they're calling my office, whatever. And they come to me and they say, listen, I have all these symptoms. My doctor says my labs are normal, okay? My tests are normal, and so it's not my thyroid. But I still feel terrible. Like I still have all these symptoms. I still have every thyroid symptom in the book. So if it's hypothyroid, they still have all these hypothyroid symptoms. Like I'm gaining weight like it's my job. My hair's falling out. I'm tired all the time, fatigued all the time. I'm cold all the time, moody, depression, you name it, right? All the kind of the classic hypothyroid symptoms. Somebody has those and they think, oh, maybe this is my thyroid. They go and their doctor says, well, your labs are normal. It's not your thyroid. So see you next time. Or they chalk it up to something else like, oh, it's menopause. Oh, it's stress. Oh, you're a new mom. Oh, yada, yada, yada. Anything, just depression, try some antidepressants. That's the line you get. So this can happen for a multitude of reasons. If someone, and again, as most of you listening to my voice right now know, if you don't, you'll hear it now. If someone does have hypothyroidism, the most common cause, or a thyroid issue in general, the most common cause of it is autoimmune, right? So Hashimoto's typically makes you go hypo or underactive, Graves' disease hyper. So by far, upwards of 90% of thyroid cases in this country, in the United States, are autoimmune. So majority of the time, it's autoimmune. So what happens is you get these symptoms, you go to your doctor, and part of the problem, a big part of the problem, is when they run these lab tests, they're only running minimal tests. So they're running a TSH screening, maybe T4 levels. But most of the time, if you don't have a diagnosis, you just have some symptoms, they're running a TSH screen, thyroid stimulating hormone. And if that's in range, if that's in the lab range, then according to them, you don't have a thyroid problem, even though you very well may. Because you may have an autoimmune problem that's causing all the thyroid symptoms, and it just hasn't shown up in the TSH yet at this point. That test hasn't gone out of range yet. It usually will eventually. That could be a week later, that could be 10 years later. But the fact of the matter is, your doctors are saying, well, you're normal, it's not your thyroid, because all they're doing is looking at TSH. And that TSH number is not out of range. If that number's in range, you don't have a thyroid problem. They're sweeping it under the rug. They're moving on to the next thing like stress, or you're getting older, or antidepressants, that kind of thing. So that's number one. Number two, if you have been diagnosed as having hypothyroidism because at some point in your life you had symptoms and that TSH did go out of range, that again is most likely where it stopped, right? Your doctors didn't dig any deeper to see if you had Hashimoto's or an autoimmune condition as the underlying cause. So what did they do? They gave you hormone replacement. They gave you thyroid hormone replacement. So your TSH went out of range because your thyroid wasn't making enough hormones. So the TSH is a pituitary hormone, and your pituitary gland kept trying to stimulate. It's what's called thyroid stimulating hormone. Your pituitary gland kept sending TSH to try and stimulate your thyroid, and your thyroid wasn't responding. 90% of the time, it's not responding because it's being attacked by your immune system, but they don't check for that. All they see is that it's not responding. Your TSH is going up, that this message keeps getting sent because your thyroid's not listening. So they say, oh, you have hypothyroidism. Here is some hormone replacement. Here's Armour, here's Synthroid, here's levothyroxine, here's Tyrosint, here's whatever you want to, whatever fill in the blank thyroid hormone replacement they're going to give you. So they give you that. What's it going to do? It's going to make the labs go back into the normal range. That's what they're trying to do, right? We're just manipulating the hormones and your levels for those to get them back into the normal range. And once that happens, and that could happen right away, that could take forever to get the dosing right and all that kind of stuff. But all they're doing is prescribing medication to get those labs normal. And eventually, once that happens, it's not your thyroid anymore. Your levels are normal. You're taking the hormone replacement. It can't be your thyroid anymore. And most of the time that happens, and someone still says, I still don't feel great, right? Maybe I felt a little better temporarily when I started taking these hormones, but now I feel like garbage again. And so you go back to your doctor 6 months later, 6 weeks later, 6 years later, and they keep checking. You're on the medication. They keep checking your TSH levels, maybe your T4. They're in range. It's not your thyroid, but you still don't feel well. But that's where it ends, right? That's where it ends. If your numbers are not out of range, right? Your TSH is not out of range. You don't have a thyroid problem. Your symptoms are something else, which is not true. If your numbers are out of range, now you have a thyroid problem. We have one treatment and one treatment only for that in medicine. And that is, here is your Synthroid or your levothyroxine or your hormone replacement or whatever we're going to give you. And we're going to treat it that way. We're going to get those numbers back in range, and then we're done and you're fixed and it's not your thyroid, whether you get better or not. And the majority of the time, someone is not going to get better and someone is having thyroid symptoms in the first place because they are autoimmune and it's Hashimoto's. Nobody checks. It's blood work, simple blood work, right? Antibody levels. If they do check and they are elevated, they'll say, yeah, we got Hashimoto's, but we don't have anything for that. So your TSH, everything else is in range. You got antibodies, but everything else is in range. There's nothing for us to treat. And so people go on suffering. A lot of people go on dealing with and suffering unnecessarily with these thyroid symptoms. Now, here's another limitation. Let's say the second scenario, you get diagnosed, you get put on these medications, and all they're doing is checking the blood levels of the TSH. So you're given these medications, the hormone replacement, so it's going to increase the levels of the hormones in your blood, which is then going to make the tests go into normal range. But you could still be symptomatic because your body's not using those hormones. Maybe your body's not converting the hormones properly from T4, which is the more inactive form, which is what they give you. So that's mostly what your thyroid makes is T4. And the medications are T4 primarily. So they're just replacing what your thyroid makes naturally. But the T4 is the more inactive form of the hormone. The T3 is the more active form. That's the one that our cells can use more efficiently. They can use T4, but our cells really prefer T3. So they're giving you T4, which is going to make the levels of your T4 go up, and they're also going to make your TSH go back into range. And then they're done. They washed their hands. They said, we'll see you in 6 months and we'll just monitor your levels, and you still don't feel well. It could be because your body's not converting the T4 into the T3 properly. So the hormones that are in your blood aren't even getting into your cells where they need to go. So we're not getting that response at the cellular level. And so you're not seeing any relief from the symptoms. The hormones are still not getting where they need to go. Now, that hormone conversion takes place in two places, primarily in your body. About 60% of it takes place in your liver, and about 20% takes place in your gut. So there's 80% of your hormone conversion that takes place in those two places. If your liver and your gut are not functioning optimally, you're not going to be converting the hormones that you're even taking as medicine. And so they're not going to get where they need to go because they're not being converted properly. Again, nobody checks for this. I do, but medical doctors don't check for this to see if this is what's happening. They prescribe the meds, they check your TSH. If those are in range, you're fine. We're done. There's nothing else to do. It's not your thyroid, it's something else. Nonsense. There's so many other things that could be happening, like you have a conversion issue, like you have some kind of cellular absorption issue. What if these hormones get to the cells and they're being blocked? These hormones can't dock onto the cells and get into the cells because those hormone receptors are being blocked from inflammatory cytokines, inflammation, or toxicities, heavy metals, things like that. So there's so many other layers to why we have to go deeper than just looking at TSH. And it's why many times over and over and over again, I have these conversations with everyone. You go to your doctor, whether you're on the hormones or not, if your levels are in range, they're like, we're done. It's not your thyroid. It's nonsense. It could very well be an autoimmune condition. It could be you're not converting properly. The cells aren't absorbing the hormones properly. So we have to fix all this stuff. We have to optimize this stuff. We have to get people's gut fixed. We have to get their liver working better. I can't tell you how many patients and how many consults I do with you guys. And it's like, I have fatty liver. I have non-alcoholic fatty liver. I'd say 30% of people I talk to have a non-alcoholic fatty liver. And so if you have a fatty liver, which can be due to multiple things, but if you have a fatty liver, you're not going to be able to, that's 60% of your thyroid hormone conversion that's probably not doing so well. Like we're probably not converting it very well because our liver's not working optimally. So we have to look at all this stuff. We have to maximize conversion. We have to decrease inflammation. We have to identify underlying autoimmune causes, and we have to fix those things. Because just looking at TSH and prescribing medication based on that, and when that's in range, telling you you're fine and there's nothing wrong with your thyroid, is doing an incredible disservice to people in this country. Unfortunately, that is the standard medical care. That's it. So standard medical care in this country is your TSH goes out of range, we prescribe medications to bring it back in range, and we're done. If it's never out of range, you don't have a thyroid problem, which you might not. You might have an autoimmune problem. But that's it. That is standard medical care. That's not going to cut it, gang. It's not going to cut it. And it's why a lot of people in this country, I'm trying to get to as many of them as I can, a lot of people in this country are suffering with thyroid conditions or autoimmune thyroid conditions, and they're not being managed properly in medicine. They're never going to be. And that's why I'm doing it. I do everything I'm doing and screaming from the mountaintops and do these every Thursday, even on Zoom, because I'm locked out of my Facebook account. So, and that's why I do. That's why I do weekly podcasts. That's why I do all this stuff, trying to get to as many people and educate people and have them understand that the traditional standard medical care for thyroid conditions in this country is woefully inadequate, because that's all it is. And that's why all of you are being told that like your numbers are fine, there's nothing wrong with your thyroid, or you're taking your medication, your numbers are in range, there's nothing wrong with your thyroid. That's why you're being told that, and that's why you still have all the symptoms, even though you're being told that, is because there's so much more to it. There's so much more to it. If you have an autoimmune condition like Hashimoto's, which most people do that have thyroid conditions in this country, upwards of 90%, that story playing out for you is never going to fix the problem. Sure, your labs may look normal, you're never going to get better because we haven't addressed the underlying autoimmune cause. That's the game plan. For those of you who don't, right, there's a small percentage of people who don't, and they're doing they have to take the hormones. They have a primary thyroid failure and their thyroid's not working. They have to take the hormones. They still might not be getting better because they're not converting it properly. Their cells aren't absorbing it properly. Multitude of things that could be going on downstream from TSH talking to your thyroid. But that's all that's ever checked. That's it, gang. That's why you're being told your numbers are normal, because either they never went out of range, your numbers, that's TSH, your TSH is in range, you don't have a thyroid problem, or you've been diagnosed with a thyroid problem, you're on the medication, your TSH is in range, you no longer have a thyroid problem. They're both falling way short of the mark, but that's it. That is the mark. That's as far as it goes in standard medical care in this country. It's not cutting it because there's autoimmune causes and there's all kinds of other factors like absorption and conversion and all that kind of stuff that need to be addressed. And I'm the only one saying these things. You're not hearing this from your doctor. I get it. So if you're ready to get all that stuff figured out and get better, let me know. Let's chat. Let's have a consult. Let's put a plan in place. But that's the story, gang. That's why that same story is playing out over and over and over again, and you're sick of hearing it, and everybody's sick of hearing it, and why nobody's getting better under standard traditional medical care. I want to thank you for tuning in to Hashimoto's Unfiltered, Real Talk, Real Solutions. Again, my name is Dr. Ray Benedetto, and I hope today's episode helped to give you the tools and the insights you need to take another step forward on your Hashimoto's journey. Don't forget to subscribe, leave a review, and share this episode if you think someone could benefit. You can also connect with me on Facebook at Dr. Ray Benedetto and on my website, drraybenedetto.com, for more resources and updates. Until next time, remember, you're not alone and real solutions are always within reach. Take care and be well.